Welcome to the Clear Skin Clinic. This presentation is an exhaustive review of laser hair reduction. This is a cross-section of our skin. Hair grows from the hair root or the hair bulb about 4 to 5 millimeters underneath the skin. By the time it grows out of our skin, it is already only a bundle of dead collagen fibers. We can cut our hair from the skin surface by either using a razor or a trimmer without affecting the quality of hair in any way. Razors do not make our hair grow thicker or longer or quicker. These attributes are genetically determined. We inherit the quality and life cycle of a specific hair follicle from our parents. The cells at the root of the follicle are the ones that produce the collagen fibers that make up one hair strand. These hair root cells require a constant supply of blood depicted by the capillary in the diagram. This is a more magnified view of the hair root. The capillary is shown entering the hair bulb at the bottom of the diagram. 30% of these cells around the capillary are in their actively growing stage at any one given point in time. The rest 70% are either busy eating or busy dying, or medically speaking, they're either in their interphase or telophase. The actively growing cells also accumulate melanin pigment, which acts as the target for laser. Laser energy is absorbed by these cells and they die of heat damage. Fortunately or unfortunately, death is a permanent event. These dead cells will never procreate again. 6 weeks later, 30% of the remaining 70% cells come into their actively growing stage and are ready for treatment. After about 6 to 10 sessions of laser hair reduction, we can expect about 80% permanent reduction in density of hair. 20% hair, mostly being lightly colored, less pigmented, will continue to grow throughout life, necessitating maintenance sessions about twice or thrice a year. Importantly, we must discuss what happens to our skin when we pull out our hair during waxing, threading, or tweezing sessions. The blood vessels supplying the root of the hair is pulled and compromised. It bleeds into the hair follicle tunnel. This extravasated blood stimulates inflammation, which in turn results in scarring and post-inflammatory hyperpigmentation. Repeated scarring after multiple depilatory sessions pushes the hair follicle towards the surface, forming a permanent goosebump. Increased pigment, however, reduces after stopping depilatory methods. Please do not pull out your hair. Waxing and bleaching play havoc with the surface of our skin. Such methods of removing hair, repeated over a very long period of time, eventually result in accumulation of multiple signs of skin damage and increased aging. This 22-year-old girl came to us with polycystic ovarian syndrome. Hair growth increases throughout the body in this condition. We had her treated at a suitable gynecologist and an endocrinologist while performing laser hair reduction at our clinic. Results: 6 weeks after the 4th session are shown on the right. A 43-year-old with thicker hair growth, unrelated to any organic condition. This 22-year-old came to us with another endocrine disorder. She had had multiple laser sessions elsewhere since the age of 15 years, but unfortunately had not been medically evaluated. We treated her aesthetically in parallel with her endocrinological treatment. Men and women of all skin types can be treated at our clinic. It is possible to permanently reduce hair from any part of the body. A 22-year-old girl with increased hair growth on her chin. In order to have the best results possible, laser frequency must be matched to skin type. Absorption of melanin pigment for different wavelengths of light is depicted in this diagram. Absorption is highest towards the violet and ultraviolet wavelengths and falls continuously towards infrared. Lasers used for hair reduction are usually in the red and near infrared portions of this spectrum. For very fair skin types, we use 695 nanometer ruby laser. For very dark skin types, we have 8064 nanometer ND YAG laser. For Asian and lightly pigmented mixed skin types, we either use a 755 nanometer Alexandrite laser or 808 nanometer LED laser. The choice of laser depends on your skin type. This is a list of lasers we have available at our clinic. Clear Skin Clinic only uses American lasers for permanent hair reduction. The advantage of having a complete range of wavelengths is that we can individualize our treatments according to skin type for optimal results. If it's not laser, we will not be using it for your laser hair reduction treatment. IPL, or Intense Pulsed Light, is broadband, non-collimated light. IPL is not laser. The energies involved are nowhere near lasers, and neither are the results. A gel is used as an interface before applying IPL handpiece. This becomes very messy. It is also contraindicated in darker skin types. No gel interface is ever used during our laser treatments. Electrolysis is an older and more cumbersome method in which each hair follicle must be entered individually in order to treat it. We do not use electrolysis for laser hair reduction. Lastly, Q-switched lasers are tattoo removal lasers. Their particular interaction with pigment will never allow them to attain any permanent hair reduction. Side effects are reported in about 2 to 3% of all people getting laser hair reduction in the best centers of the world. At Clear Skin Clinic, we strive to minimize the incidence of side effects. Please have yourself treated by a well-trained physician, no matter where you are in the world.